Good morning, everyone. Good morning. This is Bill Miles with the Chamber, and happy June 24th. It's hard to believe that we're almost through the first 6 months of the year. And in case anybody's counting, some people might have started counting by now that Christmas, yes, that's Christmas, is only 184 days away. So you might want to think about starting to prepare early. Well, welcome back. We're glad everyone is with us again this week for the Chamber's Teletown Hall. We're certainly glad to have you with us after we took last week off for the RBC Heritage presented by Boeing. I want to remind everyone that you can start submitting questions online if you have those in the chat box here on the call. So if you have any early questions that you can think of now, please go ahead and get them in so that we'll be sure to get your questions asked and answered. I'm pleased to share with you this morning that the Chamber is also launching the next phase of the Community Path Forward Readiness Plan. It's called Staying Safe Together, which is designed to remind our residents and our visitors, as well as our guests, to respect and protect our low country values and environment, and to encourage safety and certainly that Southern hospitality that has helped draw all of us to the low country. This morning, we'll also be hearing more about a partnership between the town of Hilton Head Island and the Chamber to begin distributing masks to visitors and residents, and that effort will start this Saturday. You know, it's important to remember that residents and visitors here have coexisted since the 1950s, and we've got to remember that it's not about us versus them or mask versus unmasked. I'll also remind you this morning that it's possible and it's also imperative that as a community that we continue to balance the health of our economy and jobs with the health of our residents and guests. While some people tend to focus on the negative, there are so many positive things happening in the region. We're coming off a big week with the RBC Heritage presented by Boeing with an unprecedented lineup of players and television viewers. What a week it was. We're just delighted to have Steve Wilmot back with us this morning, and we'll have him on a little bit later, and Steve will be giving us really a behind the scenes look at this year's tournament. And while it was unlike any other, Steve and his team did a terrific job with many challenges that they haven't had to face in previous tournaments, but certainly handled each and every one of them with grace and with certainly calm and resolve. But first, with us this morning to kick off our discussion, we're pleased to have with us the founder of the Points Guy, noted by Forbes as one of the world's top influencers and travelers. What started out as a points and miles blog by founder and CEO Brian Kelly has evolved into a lifestyle media brand with 10 million unique visitors a month. That's 10 million unique visitors a month, and a social media audience of over 3 million. And we're delighted to have him with us this morning and to give us his take on what's happening in the world of travel is the Points Guy himself that many of you know, and that's Brian Kelly. Brian, welcome and thanks for joining us this morning.
Thanks so much for having me.
Welcome. Well, good. Share with us a little bit some of your thoughts that you see moving forward on travel, if you would, and maybe some of the loyalty programs, how they might be helping to bring back travel, and just whatever else is on your mind this morning. It's great to see you.
Thanks for having me. Yeah, as an avid world traveler, 2020 has certainly been quite a year. I actually was supposed to be in Iceland today, but they were originally opening up to Americans on June 15th. But several days before my flight, I found out Icelandair canceled, and now Americans entering the country it's pretty much up in the air. So, I think the key trend for 2020 and what is probably a good trend for Hilton Head is domestic travel, and the good thing we're hearing from our millions of readers, this is going to be the summer of road trip. We've seen RV shares, we're renting RVs go through there's a 1,600% increase so far this year in that. I'm actually myself planning my first ever trip across the country. And consumers and travelers are really just trying to put the pieces together, just like COVID-19 and the constant influx of new information and changing information. The same is happening with travel. Just yesterday, we heard from the EU that Americans probably are not going to be invited to the EU this summer. So I think the key thing for travelers is, how do I travel domestically and how do I travel safely? That's something that we've been keenly focused on at the Point Sky, is helping people understand the risk to travel and, of course, also the benefits. So it's certainly been a challenging year, but we already see travel increasing. Just on Monday of this week, the number of TSA passengers surpassed 600,000. That's up from 80,000 at the low in April. So we've seen a pretty much week over week 20% plus increase in travelers. Most of those are domestic, but still way down from the 2.5 million that the TSA was processing a year ago today. So I think the key theme for us at the Point Sky is, educating travelers and frankly, still making sure people get value out of their frequent flyer miles and credit card points, because in these days with an uncertain economy, cash is king, and we encourage our readers to use their miles and points to still travel safely and locally. So that's the high level overview of, I think, where the current state of travel is in the U.S.
Thanks, Brian, and that's encouraging to hear about the increase in air travel. We know we still have a long way to go, but at least it's headed in the right direction right now. We have a question for you that has been submitted by Sarah, and Sarah's asking this morning, what travel brands stand out to you that has done a great job in navigating the pandemic so far?
Well, I have to give it to Delta Airlines. They, with the first wave of cancellations and people, afraid to fly, Delta has taken a very consumer-friendly approach to refunding consumers, and they've also taken a very pro-flyer stance on social distancing in flight. They're purposefully blocking middle seats and even 50% of first-class seats, which is a huge hit to their revenue. I can imagine the number crunchers there must be, it's quite a hit, especially with air traffic down and parking planes. But Delta has really shown leadership, I think, and understanding that consumers are afraid to fly and really making, bringing them back into the fold in terms of, safety and making that a priority. As far as others, I definitely think, Hilton has also, I think, on the hotel front, done a great job of being proactive with consumers and flexible on cancellations. And they also, I think, just teamed up with Lysol pretty quickly after the pandemic hit to kind of assure consumers that they are taking in-room safety as a top priority. So I think those are two of the top ones. The other airlines that are also, looking out for consumers and blocking middle seats: Southwest, JetBlue, and Alaska Airlines. So if anyone on this call is thinking about traveling and the prices are the same, choose an airline that is going to block the middle seat or block capacity. American and United are selling planes full. So just want people to be aware that you do have choices when traveling, and if all things are equal, you might as well fly it on a plane that's less packed.
That's very helpful. Thank you for pointing that out. Another question here from Tom, Brian, is what's your prediction for the fall travel?
It's so hard to tell, because this isn't just, we're now predicting public health trends. What we're seeing today, record number of cases in the US. Some people are calling this the second wave hitting now. I think Fauci said today, well, no, we're still in the first wave. We can't quite call this the second wave. So, a lot of smart people predict that there could be a true second wave in the fall. But not knowing if that's going to happen or not, I would say, people are getting more and more comfortable traveling, and I think that's a trend that we'll continue to see. And I think, people are now more comfortable with the virus, comfortable knowing what it takes to protect themselves and their families, even though there's still a lot we still need to know. I myself have the antibodies, but it's still a little unclear what exactly that means. I personally find solace in it, and knowing that I had pretty much an asymptomatic case of COVID. So I think a lot depends on things out of my control, but I would foresee us being at if I would guess by this fall, we'd be well over towards 1.5 million travelers daily. Where today we're at basically 600,000. So I'm bullish on travel, and I think it'll continue to increase as the year goes on.
Good. We have Kayla asking this morning about your summer RV road trip and kind of what that looks like and what type of experience you're expecting there.
Well, clearly, if I'm going to go from I live outside of Philadelphia to the West Coast, I've got to make a stop down in Hilton Head. So,
Amen. Thank you.
I actually haven't been to Hilton Head over 10 years, so it's definitely on my list. But I think the road trip, for me, I adopted a dog during our quarantine, and I want to take him along. So it's kind of fun. I'm looking to do national parks. I'm ashamed to say I've been to the Maldives 5 times, but I've never been to Yellowstone. So yeah, I'm looking at planning a trip with some friends in an RV, and taking my time, so haven't done too much planning, but I definitely want to check off a bunch of states that I've never visited.
I want to remind you, Brian, that Hilton Head Island, as well as Bluffton, is very dog friendly. So when you're traveling, remember that, and we would love to host you here on the island and in Bluffton as well. One more question for you, Brian, and that comes to us from Ted. And Ted is asking, with the capped occupancy at some of the hotels that we're seeing around the country, as well as lower occupancy, what do you see that doing to the reinvestment back into the properties that hotels usually do every 5, 7, 8 years or so? Do you see a delay in that?
I absolutely see a delay in that. The hotel chains are not quite as dire as the airlines in terms of the amount of just money they're burning every day to stay afloat, or the cruise lines for that matter. But I think, I think there's going to be a lot of changes for potentially forever in terms of the service levels and amenities that you'd expect at full service hotels. If you go stay at a hotel today, you're not going to get housekeeping daily in most hotels, and there's no room service. And I think it's going to take a while for consumers and hotel brands themselves to figure out, what are the new perks that they should be offering. Clearly safety is one of them. So I don't think it's going to be a terrible thing for the industry long term. I think it's just today, now is the time. How do you have a tall hotel and packed elevators, right? And so I think there's a lot that is going to happen. I think as we learn more and more about the virus, people will be more comfortable staying in hotels. But yeah, I don't see huge investments today or this year in hotels.
And the last question here comes to us from Sally. And Sally is asking, if the loyalty programs, do you think that they'll continue to provide points and allow customers to use miles?
Absolutely. I mean, so American Airlines and United just basically put their loyalty programs up as collateral for loans. Those programs were valued anywhere from $20 to $30 billion. Hilton and Marriott both sold about $1 billion worth of points to the credit card companies. So, the loyalty programs are huge revenue drivers for travel brands. So, and we've already seen a bunch of airlines like Emirates and Qatar, All Nippon, reducing the amount of fees needed to redeem your miles. So that's a trend I hope to see. Airlines make it easier to use your miles and points. We see incredible availability. If you do want to travel, I highly recommend use your points and miles now, especially for first class. If social distancing is important to you, business travel is still pretty much off a cliff. So redeeming your points and miles for first class or, the premium economy seats can be a good thing, not just for the luxury of it, but for your safety.
Brian, we're sorry you couldn't be in Iceland today, but we're delighted that virtually you could be on Hilton Head Island with us. And we look forward to seeing and hosting you here during that RV road trip.
Can't wait. Thanks so much for having me.
Thank you. See you soon. Take care. That was the points guy, and we're delighted to have him with us. And Brian Kelly, during conversations last week with family and friends, they're like, "Oh, the points guy, huh? That's going to be great. We're looking forward to hearing him, and certainly has a great following." So, Brian, thanks again, and we hope to talk to you and see you again soon. We're going to transition from the points guy to South Carolina Parks, Recreation, and Tourism, and we're pleased to have back with us this morning Dwayne Parrish. Dwayne, look forward to hearing from you on a state perspective.
Good morning, Bill.
Good morning.
Yeah, appreciate you having Brian on. Very interesting hearing his thoughts and comments about travel. I thought I'd take just a second to give us sort of an update of where we are in status and what's going on and what's coming up. So we now are down to 28 hotels still closed. That is down from a 35 hotels last week and from a high of 575 at one time. Of that 27, 12 are in downtown Charleston. We've also identified 11 that will stay closed beyond July 1st with taking this time to undergo renovations. On the occupancy front, I'll sort of give you the I've got monthly results from the month of May. I thought I'd share those with you. So for the month of May on the hotel side from Smith Travel, so the U.S. occupancy in May was 33%, which was down 51%. The Southeast was 34%, which was down 51%. And then South Carolina was at 38%, which was down 44%. So our data from AirDNA, which tracks short-term rentals such as vrbo.com, airbnb.com, homeaway.com, and the likes of that. For the month of May, their occupancy was 55% for South Carolina, 52% for the Southeast, and 55% for the U.S. These numbers were pretty close to their occupancy last year, as short-term rentals were faring pretty well prior to COVID and certainly seem to have flourished through COVID. I think as more people are looking for more space, as in square footage, looking for more places with kitchens in case they don't go out as much. That certainly seems to be the case today. Also within the hotel realm, we do know that long-term stay hotels like products like Residence Inn have fared better than standard hotels. Bringing you a little closer up to today, I do have the weekly occupancy numbers for hotels for the week ending June 13th. And you'll hear these as compared to May, which was all in the 30s. So the U.S. occupancy the week ending June 13th, which was a Saturday before last, occupancy for the U.S. was 42%. Occupancy for the Southeast was 44%, and occupancy for South Carolina was 52%. With Hilton Head coming in second in the state at 63%, just behind Myrtle Beach at 67%. Certainly much improved numbers, while a long way to go, much improved numbers over the month of May. Certainly appears to be people are headed toward the beach, being outdoors. This is the time of year anyway. And I think, of course, being in lockdown for several months has just added to that. But certainly good to see the numbers go up. That's our 9th consecutive week of an increase in occupancy. And actually the 3rd week in a row, we have led the Southeast as a state in occupancy. On our marketing side, our We're Ready When You're Ready campaign continues to go. If you're looking at my screen, that's the virtual picture you see there now. There's a picture of a lifeguard. That's a still shot, but essentially a lifeguard come back to the beach, back in the lifeguard chair with his sunglasses on. We continue to do that as a sign that we are open for business and welcome people back. You may have seen yesterday, the South Carolina Restaurant Lodging Association has started a program called Palmetto Priority, and that's also the website if you'd like details, palmettopriority.com. It essentially is a statewide program for restaurants, both members and non-members of the state association, that they agree to sign a pledge that requires a number of things, such as all employees wearing masks. If the restaurant signs up for that, they get the window cling. The window cling has a QR code in it, as well as the website I just mentioned. Customers can go on and give feedback. The restaurant association will follow back up with the restaurant with any feedback. And that is trying to be an industry-born program to sort of get more restaurants on board where their staff are wearing masks, social distancing is taking place inside the restaurant, and trying to continue to instill consumer confidence in those things. Our state parks this past weekend had another busy weekend. We had 12 state parks reach capacity, including Hunting Island in Beaufort County. All of our retail is open, full capacity. Our picnic shelters, event venues have all reopened. All of our staff and state parks have been wearing masks since we reopened on May 1st. We had a ribbon cutting on Monday for Hunting Island, where beach renourishment was complete. We've now planted a little over 200,000 plants along the sand dunes that we have installed, if you will, or created for the protect renourishment as we go forward. I want to say that state parks, the month of May, we did not have retail open. We did not have shelters reopen, and it was the highest revenue month ever in the history of state parks. That goes to show a little bit of that people, as I mentioned earlier, about people wanting to be outdoors, outside, and a lot of that cabin fever. And in June, with retail reopened, I anticipate June's revenue will be even higher than May's. So we'll continue on in state parks with the success that we've got going so far. We have a lot of capital projects that work on this winter. And given our budget has been passed by the state with the same budget we had last year, we anticipate taking care of some of those same projects. I know Steve's going to go into details, but I want to give one note on the RBC Heritage, and two actually. One is congratulations to Steve and his staff for pulling off a RBC Heritage 2.0 in June. Was absolutely phenomenal. The rain delay during the 2.5 hours on Sunday was just tremendous coverage. CBS and the Golf Channel had a drone that just showed really truly $1 million money shots of Calabogie Sound, Sea Pines to Fusky. Was phenomenal. And from the tourism perspective, and really for golf in South Carolina, it was a tremendous weekend. So congratulations to Steve and his team. Yesterday started 27 hours of television coverage on the Tennis Channel. It is the WTA, the Women's Tennis Association's first event. There is two 8-person teams playing against each other from now through Sunday on the Tennis Channel. As I mentioned before, and still continues to be, entertainment venues are still closed. That includes racetracks, movie theaters, live performance theaters, and concert venues. Those are certainly being looked at each week by DHEC as well as the governor's office. And lastly, I thought I would share with you some of the Longwoods information travel sentiment going on. So this is as of yesterday morning. There's a couple of bullet points I'll share with you here. The recent official and media reports of spikes and surges of new cases of COVID-19 in almost half the states appear to be having an impact on travel sentiment by flattening some of the positive trends we've been seeing since mid-May. Several key indicators, including those changing travel plans and those saying the pandemic will greatly impact upcoming travel plans, remain unchanged from where they were 2 weeks ago. Support for opening up one's own community to visitors also saw a slight dip from 2 weeks ago, now to 41%. On the positive side, concern about the economy greatly impacting travel plans is back down to 17%, where it was on March 11th, which is about the time the pandemic started. So having funds to be able to travel doesn't appear to be as much as an issue as we once thought it was. And lastly, it says our data this week shows that travelers are more likely to support those businesses that demonstrate a clear, thorough cleaning and hygiene plan, which test staff and the use of PPEs, including masks, and that have those controls in place for social distancing. You heard Brian mention a little bit about Hilton and some of the other products he thought that, as well as airlines, that were handling that real well. I think as we go forward, we'll see more of that consumer dictating when and where they feel safe, particularly with the social media being able to spread that word. So, Bill, pending any questions, that concludes my report.
Dwayne, thank you. Question for you. Several of the local resorts here are capping occupancy so to certainly enhance the guest experience and provide additional safety, et cetera. Are other hotels and resorts around the state, are you seeing them do that as well?
Not many. I think most started out that way somewhat, but I think as they reopened and became more comfortable with their cleaning protocols in place, I think, at one time they were like renting every other room down the hall. Sometimes some were leaving a room open for 24 hours before it was re-rented. I think most of that has subsided now as two things have happened. Demand has increased and I believe they're more comfortable cleaning the rooms now. Staff is more comfortable. Training is taking place, and I think there's not much of that going on now.
All right, thank you. A question from Mayor Salka is regarding the Palmetto priority, and how, as she's asking, how municipalities can get this info to share with the restaurants.
Sure. The quickest and easiest way to go is to go to palmettopriority.com. There is the one-page information about the program. You click on a link that gives you the detail of what you're pledging to. It requires a little bit of training from the restaurant management, and I say it's less than 30 minutes of training from the restaurant itself. And then there's a link to an application. They can fill it out. It'll get processed quickly, and the window cleanings will be sent out right after that. And then there's also a place for, as I mentioned earlier, about patrons can go on and make comments as well. But the easiest way is to send out palmettopriority.com is the website.
All right, thank you. palmettopriority.com, and we'll post that in our chat box as well. Dwayne, you mentioned a little bit about the television coverage, and I'd like for you just to reiterate what you see as the value for South Carolina, for Hilton Head Island, for the coverage that we receive from the RBC Heritage, not only nationally but globally as well.
Well, locally, we all know how beautiful Low Country is in our state, but to the person in Kansas watching it, that's all new, and unless they've been there before, and it's just phenomenal coverage. The cost of your agency or our agency to go send a drone up and get national television coverage in front of an audience of millions is just cost prohibitive for us. So what this tournament does, and it's not honestly, it's not just Hilton Head. It is Myrtle Beach. It is Charleston. It is Georgetown and Beaufort. It is our entire coast, and it is even just South Carolina golf throughout the state to sort of showcase that, again, to the person in Kansas, Pennsylvania, Wisconsin, New York. It is a wow. I mean, it's just phenomenal footage of what's there. I heard Defusky Island must have been mentioned at least 15, 20 times on national television. And so, things like that are just, there is no way to replace that by buying that kind of coverage. I know Jim Nance has a certain fondness for Hilton Head. He certainly made the effort to come back in person. And he always talks about the place every time he comes. And I just think it's, again, the value of this is just above and beyond what anything else we could possibly buy.
Dwayne, thank you for joining us again this morning, and great to hear your perspective and the state perspective. And again, as I tell you each time, we appreciate the support that you provide to South Carolina tourism and certainly Low Country tourism as well. So thanks for being with us, and we'll talk to you soon, Dwayne.
Thank you, Bill.
You heard Dwayne talk quite a bit about the RBC Heritage, as well as hearing some from me. We're going to move on to Steve Wilmot, who's the tournament director. And Steve, welcome back on again this morning, and terrific job from you and your entire team last week. Congratulations for a job really, really well done under some very trying circumstances.
Well, Bill, thank you. And I'll give a little thanks here too to Dwayne. And Dwayne, please do understand that extra 3 hours of coverage that we got for everybody was not planned on our behalf. So, one thing we have no control over is Mother Nature, but it certainly worked in our favor, and we finished up in great fashion. But thank you. I'd like to thank the entire community, the support and effort that we had from our local and state officials, certainly from our mayor and town manager, along with Bluffton's manager and town managers, mayor and town manager, Sea Pines and the CSA here too, the resort. It was incredible to pull off 2.0, as Dwayne mentioned, in a way that certainly showcased this community as well as the state of South Carolina. And others that I'd like to thank are truly the residents and the renters and the rental companies here that truly were respectful and understanding of the uniqueness of this tournament this year. It was very strange, but it turned out to be a great week, and we certainly didn't have any problems or issues with regards to from the social distancing and the health and well-being that we were so sensitive about going into the April event that didn't happen, and then also this event that just happened last week. But And then working too, which I'll get into a little bit from an operations side, working as closely as we did with the USCB, as well as the Hilton Head Hospital on the front end and back end. Truly a community effort, and one that I'm extremely proud of, and we all should be, because we were presented an opportunity that no other tournament in the country was. We pulled it off, and and hopefully there'll be some true benefit to it moving forward. And I also like to thank the volunteers as well. We've offered to pay some of our volunteers overtime twice as much since they volunteer their time, but they worked extra hard because of the weather delays on Friday and Sunday. And if it wasn't for them, we wouldn't be able to do what we did and pull this off as well. So, but the interesting thing, Bill, we have our own, we have our own Christmas countdown, and it's only 292 days to April 12th, 2021. So we're 10 months away, and we're already in the planning phase. But just a little bit from an operation side of things is, we started a week ago last Saturday with our testing of all players, caddies, as well as certain officials, volunteers, and staff on last Saturday, and that was at the University of South Carolina, the campus here on Hilton Head. Players and caddies registration was also held there Saturday through Wednesday. The testing itself was done by a third party, a mobile unit, along with support in the outside of the facility. And then all players, anybody that was tested, could not have access to Harbortown until the results came back. So that process happened. There was 3 sites that were around the clubhouse, on the golf course, and our volunteer lots. Of thermal testing happened each and every day last week, and that process was worked through a third party as well. Monday of last week, some of our trustees, along with Bill Miles, we went to the Savannah Hilton Head Airport, met 2 of the charter flights of the players that flew in from Fort Worth, along with CBS flew in on a charter plane. Savannah Hilton Head Airport had a cannon salute and had some really neat things throughout the airport to support the players, and then two airplanes flew out yesterday to go up to Travelers. We had the strongest and largest field we ever had. We had some international players such as Tommy Fleetwood and Lee Westwood and Patrick Harrington that unfortunately withdrew prior to coming here because of the 14-day quarantine where they live overseas, but they had wanted to be here. A couple of things that we did do last week. Wednesday, we presented Davis Love, our 5-time winner, a trophy that represented all 5 years. He lost his trophies in a house fire. That he lost his home back early spring. Just something we thought would be nice to do, and he was very taken back, and it was a nice moment, personal moment. But he's done so much, meant so much to us, this tournament, this community, and to the PGA Tour. We also presented a little trophy to Lance Barrow, this was his last production. He's been in the business over 40 years, and I've known him 30 plus years, and we just felt a little way to thank CBS. They love it here. We've got Jim Nance on tape over the years saying that the best 3 hours of Augusta is the 3-hour drive to Hilton Head. So it's a special place for the CBS team as well, and I think that's one of the reasons we get such wonderful broadcasts, is the fact they love coming here to the Low Country and being a part of this community. CBS, what was different certainly this year too, is where they normally have one CBS compound, there's 3 compounds around the golf course. So the build out was actually larger than it had been from a production side, but they were keeping social distancing as well as their sensitivity and testing that was done within their organizations. And PGA Tour Entertainment, which handles PGA Tour Live and NHK and some other production around the world, they were in a separate area. So we had 3 production locations, compounds on the golf course because of the social distancing and keeping them away from each other. The drone was a new aspect of live golf, and I think it showed better here than it's ever been anywhere. And there's not another place on the PGA Tour in golf as beautiful as this low country and the Harbortown Golf Links, and that I thought was extremely special for all of us. Webb Simpson obviously was a great winner on Sunday. Anybody could have won. Webb being a RBC ambassador, we always say around here, happy sponsor, happy life. So he's going to be a great champion. He's moved up to number 5 in the world now and will represent us in an incredible way, throughout the course of the year. We did Friday. We did have a player that was had arrived here, had been tested, did come down and was tested. He was negative when he arrived, but he felt some things weren't right. Honestly, it was his Whoop fitness tractor, which checked his respiratory rate, and he felt something was wrong. He went to the medical pavilion on site, which is managed and run by the Hilton Head Hospital and their wonderful staff and team. And the test came back, and the hospital got into motion, and there was a plan in place. There was policy and procedures in place, and I really appreciate all the efforts of this community, the doctors as well as the hospital, in addressing that. A second player has been identified on the PGA Tour of having the virus, but he was not at our site this last week. But the health and safety and well-being of this individual and those players, and certainly those that are affected by this, are certainly a concern for all of us. But another thing another thing that happened last week was our support from Boeing. Boeing again is a great partner. Boeing, South Carolina, it's important to them. This event's so important. The giving back aspect is so important to them and us. And they had the flyover, which was pretty incredible. 4 o'clock on Saturday, in the CBS broadcast, that was the Dream Lifter, which is an aircraft that transports different types of equipment, but it's the biggest aircraft they have in their entire fleet. And then what's happening right now is, the tear down, the cleanup. It's obviously a little less because of no bleachers and concessions and porta johns and crowd pleasers and some of those things. But if you came out here today, and especially tomorrow, you would think a tournament didn't even happen. But Harbortown had 240 players yesterday, the most they've ever had on the books. They're back open for business. And I commend the efforts of our team here, the staff, the leadership from our foundation to give us the resources to do what we do, and then again to be able to represent this community, to work with this community, is truly an incredible opportunity, an incredible privilege to be able to do this and showcase this great state and this great community around the world. But again, thanks to everybody. I appreciate it. Again, it's 292 days till next April, and again, we appreciate all the support.
Steve, thank you. That was a great recap. And before we let you go, if you could just touch on the Plaid Pledge for a minute, I think it'd be great for the listeners to get an update on that.
Yeah, I'm sorry. Thank you, Bill. Yeah, the Plaid Pledge was a program that we started to thank those working with the South Carolina Hospitality Association, but those that South Carolina Hospital, those first responders, those workers that were affected by the COVID virus, in helping and assisting what was going on in the world. And as you could probably see last week, on the back of the caddies were those South Carolina hospital workers, so on the back of caddy backs with players' names on it, and they were recognized. And those individuals will be receiving those caddy backs and those caddy names and so forth. But it's just a little way to, hopefully, a great way to support all their hard work through this pandemic, but then also for all they do for us throughout the course of the year. And please look up the Plaid Pledge if you can. We're going to run this program through the end of the month, and any support, any help will be. It will benefit the South Carolina Hospitality Association, Hospital Association, along with 50/50 with the Heritage Classic Foundation. So, but thank you.
Steve, great job. Thanks you and your team, and you always make us proud. So one other suggestion is just try and get some rest this weekend.
Yeah, you bet. We're already planning. We got a staff meeting here right after this, and we start looking at next year already.
Full steam ahead. Love it. Thanks for being with us, Steve. Sure appreciate it. Also, as Steve had mentioned, and I'd certainly like to echo the efforts of the Sea Pines Resort, the golf course, and what great shape that was in, as well as the protocols that they put in place. I believe it was about a 25-page protocol that Sea Pines Resort had in place, and was able to share with the tour and provide confidence in the experience that the players would have at Harbor Town. So again, congratulations to the Heritage Classic Foundation and Sea Pines and the entire Low Country region for pulling off another first-class golf tournament. We're going to shift gears now to healthcare, and we're pleased to have Jeremy Clark back with us. And Jeremy is the CEO of Hilton Head Hospital. The hospital certainly has been a great partner in this community for years and years and years. And certainly during this COVID time frame has really been lockstep and hand in hand with the community. And Jeremy, thank you for doing that. Thank you for your support of what you and your team and the hospital did for the RBC Heritage. And also want to give you a shout out. Yesterday we had, as you know, we had our annual Business Golf Classic, and our certainly safety was a concern of ours. And it was great to have one of your team members from the hospital be with us, checking temperatures of each of our players and clearing them to play before the event started yesterday. So love to hear an update from you, Jeremy, and just can't say enough good things about what you and the hospital are doing. So thank you for that.
Well, great. Well, thank you, Bill. Thank you for having me back today. It's great to be back with this group. And I'll just start off by congratulating Steve and all the members of his team on such a great heritage. Really great to see the whole community coming together, and just great to see the success of the event as it was. Just really outstanding, really awesome to watch. Also, I will echo the support on the Plaid Pledge. It was really cool to see some of the names of our caregivers on the caddy bibs along with the players there. So very cool idea, and I know that our team, our colleagues here, really appreciated it as well. So I appreciate being back with you. As in previous weeks and now months, the Hilton Head Regional Healthcare continues to operate effectively and safely. I wanted to start off today by giving everyone an overview of what we're seeing here locally right now. So I'll start off by saying that Hilton Head Hospital and Coastal Carolina Hospital currently have a total of 4 COVID positive patients in-house. None are in the ICU, none are on ventilators, and this is not a surge or a spike. This is in line with approximately what we've been seeing over the last couple of months. It represents a very small percentage of the total number of patients that we have in house, and an even smaller percentage of the total beds that we have available. So we're not seeing that spike in hospitalizations of COVID-19 patients. We are doing a lot more testing. We did over 500 tests last week, and we are seeing an increase in the community. But that said, most of these patients, their symptoms are less severe than we've seen in the past, and they're not severe enough to warrant hospitalization. So that's a very good thing. You know, if we do see a surge of patients, we believe that we're ready. We've worked really hard to create a safe environments inside our hospitals, really built around the principles of testing, screening, spacing, and cleaning. And, I mentioned testing earlier. We're performing around 500 tests a week. And most of these are being done at our outpatient drive-through testing centers, which are located on the campus of both Hilton Head Hospital and Coastal Carolina Hospital. And so on every weekday morning, any patient who has a physician order can show up and without an appointment and get tested for COVID-19 with no cost to them. So we're seeing a lot of patients take us up on that, get the physician order for the testing, and then show up in the morning and be tested. But additionally, we're working with certain organizations in our community to host one-time larger testing events. And these events that we're going to be hosting are free. There is no physician order required, no appointment is needed. And we've got one coming up on Friday, June the 26th at St. Stephen's AME Church in Hardeeville. That's 710 Main Street in Hardeeville. It's going to be taking place from 8 a.m. to 2 p.m. And then we have another that is coming up on Monday, June the 29th at Hilton Head Fire Rescue Training Center, located at 75 Dillon Road on Hilton Head Island. That's going to be from 7 a.m. to 1 p.m. And we're currently working with other community partners to host more events in other locations in the community over the course of the summer. But we're very fortunate to have such great partners in the community, St. Stephen's Church, Volunteers in Medicine, Hilton Head Fire Rescue, and DHEC, who are really working hard to help us make these events happen. And for all the latest on testing updates and testing options locally, I would advise everyone to check out the DHEC website and see where they can get tested and on what days. But testing is really only one part of it. We've also created a very safe environment inside of our hospitals. We appreciate our patients trusting us with their care, and patients are returning to seek care right now. We're performing elective surgeries and procedures. We've been doing that for over a month now. And we are also allowing one visitor per patient per day into our hospitals. And again, we can do that because we feel confident in the safe environment that we've created. But we also know that everyone entering our hospitals, that's our patients, our visitors, our colleagues, physicians, everyone is going to be screened. They're going to be asked questions about their symptoms. Their temperature is going to be taken, and they're going to be required to wear a mask. We feel like we've created a safe environment. We want to maintain that safe environment for our patients. We're also spacing everyone appropriately, not only in our waiting areas, which we're doing, but also with our patients. You know, we have all private rooms, so patients don't have to worry about being placed or sharing a room with a potentially COVID-19 positive patient. Additionally, all of our COVID-19 patients are being kept in designated areas, designated units, which are away from most of our surgical patients. So finally, we are cleaning more than ever before. We've added to our great environmental services team. Our own colleagues are working hard to wipe down their own areas, taking more responsibility there. And we've invested in multiple UV light air disinfection units that we've placed around our hospitals, which do a great job of cleaning the air and working to keep our patients safe. So, Bill, all this to say that we remain ready. We've created a safe environment to provide care in today. Patients are returning and trusting us with that care. We remain ready to handle a surge of COVID-19 patients if we see that. Right now, we are not seeing it, though. We really appreciate the leadership from our state and our local officials, and we appreciate everyone's support for our caregivers. And with that, Bill, I'll turn it back over to you.
Jeremy, thank you. And as you know, from the very beginning, we were talking about facts over fear, and you certainly sharing the facts with us is greatly appreciated. So keep up the good work. And we'll talk to you soon, Jeremy.
Great. Thanks, Bill.
Thank you. We'll now have Dr. Michael Katka. Dr. Katka is with South Carolina DHEC and give us a statewide perspective. Dr. Katka, welcome back.
Thank you. Good to be with you on this call again, and good morning to everyone. So as in the past week, we're reporting 6,601 confirmed and 27 probable new cases. We've started reporting our probable cases as well. So this brings the total number of people with the disease in South Carolina to 26,613. That number includes both the confirmed and probable cases. For Beaufort County, this includes 273 new confirmed cases and 1 probable case in the last week, for a total of 911 confirmed and 1 probable case for the county. For the Hilton Head zip codes of 29926 and 29928, total number of cases there since the beginning of reporting is 187. For the Bluffton zip codes 29909 and 29910, a total of 285 cases have been reported. Unfortunately, we're also reporting 66 additional COVID-19 related deaths in the state in the past week. This brings the total number of people who have passed away from the virus to 673. There was one additional death reported in Beaufort County, in a Beaufort County individual. That brings the total there to 16 for the county. So over the past few weeks, we've seen an accelerated rate of new infections in South Carolina. An average of 1,050 new infections per day have been reported in the past week. That's up from a daily average of 571 from the previous 2 weeks before that. We are now seeing some of the highest daily numbers of cases we've seen since the start of the pandemic. For Beaufort County, the daily average over the past week has been 40 cases, which is an increase from 20 cases per day in the previous 2 weeks prior to that. So we understand everyone is growing tired of hearing about and taking the same daily precautions. I want to reiterate that COVID-19 is not over, and unless we take responsibility to act now, it will not be over anytime soon. The next couple weeks are critical to stem the tide of rapidly rising case counts. In particular, one of the concerning trends that we've seen in our data is a growing number of South Carolinians under the age of 30 who are testing positive. This is something we're seeing at the national level as well. One thing to note about this increase that should be interpreted with caution is that this younger age group was not part of our original priority testing group when tests were in short supply, and they may not have been receiving the tests early on in the response, which may account for some of the shifting numbers to this younger age group. But they are not the sole reason that we're seeing rising cases. We're seeing rising case numbers across all the age groups. So for our part, DHEC is increasing our monthly testing goal and looking at better ways to get this important preventive message out to areas where it's not being received and followed. To stop the virus requires each of us taking actions every day to protect our health and the health of those around us. This includes wearing a mask when we're in public and staying physically distanced from others. Businesses must implement policies to make this easier, such as posting signs as a reminder, enforcing social distances within their establishment, and requesting that patrons wear a mask while indoors. And I appreciate hearing earlier that the county will be working on providing masks. I think that's a very important step. And that's about all I have to report. For any other updates, you can visit our website, scdhec.gov/COVID-19, and I'm happy to take any questions now.
Thank you, Dr. Keck. First question comes from Ted, and you had mentioned that 187 cases in the zip codes for Hilton Head Island and 285 for Bluffton. Do you know how many of those are current active cases?
I unfortunately don't have the numbers down at the zip code level. We only have the percent recovery at the statewide level. Okay,
very good. Dr. Kaka, thank you for that important update, and thank you again for being with us. We look forward to hearing from you again. That's all that we have for you today, so thank you.
Thank you.
As we get ready to wrap things up, I want to mention that if anyone is interested in volunteering to be part of the Staying Safe Together Ambassador Program, which we're launching, simply email us at pathforward@hiltonheadisland.org. That's pathforward@hiltonheadisland.org, and we'll provide you more information on how you can be part of this very important effort. And you know, starting from the beginning, we were certainly talking about facts over fear, and that's something that we continue to talk about and during this pandemic, and it's more important, I think, now than ever. And we'll continue as a Chamber of Commerce to convene and convey, as well as connect our community this post-quarantine time, as we continue to support the health of our residents, guests, and the health and success of our economy. I want to thank each of you for joining us this morning. We look forward to having you with us again next week. We thank our partnership with Beaufort County and the County Channel for airing this each week, as well as sharing it on Facebook Live, which allows us to reach thousands of listeners each week. Continue to join us, and thanks for all you do. Stay safe, wear a mask, and we'll talk to you soon. Take care. Bye.